J-E.
Very good. And what is this?
A cactus.
Sorry. You're okay. Take your time. Perfect. Okay, so posture is great. Clavicles, midline. Right side is slightly pink, but otherwise normal. If I could have you stick your tongue out for me. Good. And say,
99. 99.
Any pain or discomfort there?
No.
Good. And the other way? Any pain or discomfort there?
No.
Good. Any tenderness at the brow?
No.
Right.
Yes. Yes.
Deep breath in. Good. And release. Just looking for the natural flexing of the muscles upon stimulation. Brittany, hello.
Hi.
Hi, how's it going? Good morning. My name is Dr. Perez.
Good morning.
It's good to see you this morning. I know it's fairly early. Thank you for being on time to your appointment. I appreciate that. So it looks like I have you in as just a new patient annual exam. Is that correct?
Yes.
You're just doing a physical assessment today?
Mm-hmm.
Okay. Just looking over your notes, it looks like we do have all of your history that was transferred over from your previous doctor. So I have that you're just new to the area.
Mm-hmm.
Very nice. Well, thank you for coming in. We appreciate having you. I do have quite a thorough head-to-toe physical exam to go over with you just because you are new to our clinic. Have you ever had a head-to-toe examination before or like a regular annual physical checkup?
Yeah, but it was a while ago.
A while ago? Okay. Do you remember if there was anything specifically wrong when you had that examination done?
No.
Yeah. Okay. Do you have any specific complaints or ailments today? Any aches or pains? Anything abnormal going on?
No.
Good. All right. So I'm just gonna ask you a couple questions, kind of going head to toe, see if anything is bothering you lately. Any issues with your eyes, blurred vision, double vision? No. Do you see an optometrist regularly? Have you ever?
No.
No. Okay. So no prescription glasses, contacts.
No.
Any issues with your ears, hearing? Do you ever have trouble hearing? No. No excessive earwax or like protruding out of the ear?
No.
Okay. Moving on to your extremities. Any pain of the joints, ligaments, upper extremity, lower extremity? No issues there?
No.
Alright. Any gastrointestinal issues?
No.
No. Do you follow any specific diet, vegetarianism,
No.
anything like that? No. Do you feel like you're getting in enough fiber, protein,
Mhm.
prioritizing fresh fruits and veggies?
Mm-hmm.
Alright. Physical activity, are you fairly active?
Mm-hmm.
Okay. How many days a week would you say you work out?
5.
Okay, so pretty active. Very good. Are you working in cardio, weightlifting?
Both.
Okay. Good. So definitely recommend that you do a combination. Alright. Any issues with your feet, toes, corrective
No.
shoes, anything like that?
I do get shin splints sometimes.
Do you? Okay. Are you a runner?
Yes.
That is very common. Unfortunately, the only thing really to alleviate shin splints is to take a break from running, which I'm sure you're aware of, which most runners are not willing to do. So.
Yeah.
As long as it's not something that's affecting your gait just on a day-to-day basis, it should be okay. If you feel like it's flaring up, you might want to just take a couple days off in between, especially if you're doing long distance running. Proper footwear also is obviously imperative. Has it ever been bad to the point where you had to seek medical care?
No, just take time off.
Just take some time off, okay.
Get some new soles.
Alright. So there is a specific mileage depending on the shoe that you're buying. A lot of companies now will have it listed on the website. X number of miles means you need a new pair of shoes, so just something to kind of keep in mind. Alright. And as far as your hormonal health, any issues with period, pregnancy?
No, it's pretty normal.
Pretty normal. Okay. No excessive cramping or anything?
No.
Alright. When is the last time you had a mammogram, if ever?
I've never had one.
You've never had one. Okay. So you're obviously still fairly young. You're not at the age where we would start doing an annual, but you are over the age where we would recommend you have one just as a preliminary. Do you have a gynecologist or OB that you see regularly?
Not since I'm new to the area.
Okay. So I can give you a referral to the clinic that we work with in-house, and they can get you in usually fairly quickly. It's not something I would say is emergent just because you are so young and healthy, but I would recommend that you get in within the year if you can. Okay. So I'll send that referral over, and then you can access all of that in your portal online. Have they helped you log into that and everything just yet?
Yes, I think to confirm today. Yes,
Okay.
I did.
And then all of the notes and everything from today will go in there as well. As well as your vaccination record later when we give you your flu shot, that will be there as well. Okay. All right. Just a couple questions about your cognitive health. Do you ever find that you have issues with your memory or trouble gathering your thoughts, focusing?
No.
No trouble sleeping?
No.
How many hours on average would you say you sleep a night?
Between 6 and 7, I'd say.
Okay. A little lower than average, but do you feel like that's adequate sleep for you?
Yeah.
Okay.
I feel like sometimes when I get more, I'm a little bit more groggy.
Okay. So everybody is different. I would say as long as you're aiming around that 7-hour mark, you should be okay. Obviously, listen to your body. Do you feel like you nap frequently or?
No.
Good. Okay. So I would say that's everything for our preliminary assessment here. Did you have any questions before we get started?
No.
Okay. All right. So let's go ahead and begin. Typically these tests kind of function in order, so we'll just kind of literally go head to toe and see if there's anything concerning. I'm going to start with just a basic cognitive assessment. Make sure that there's nothing concerning going on with your brain or with your neurological health. So just got a stroke evaluation here. I'm going to point to a series of things, and I'd like you to just attempt to identify them to the best of your ability. So just got a chart here. You're going to see a couple of people. If you could tell me one or two things that you see that's kind of out of the norm here.
The water is flowing out of the sink.
Good.
And the stool is about to tip.
Very good. Okay. And on this side, I'm going to ask you to point to a few objects. So if you could point to something you would find outside somewhere.
Outside.
Very good. And what is this?
A cactus.
Good. Can you point to an object that you would sit down on? Very good. And what would you use to open a door?
A key.
Perfect. Okay. All right. So I just have a couple of words here. I'm going to ask you to read this aloud for me.
Mama.
In here.
50-50.
In here.
Thanks.
And if we can read this word here.
Player.
I'm going to have you read just a simple sentence for me.
I got home from work.
Very good. So no issues with your ability to read. And you were also able to identify objects and point out a scenario that was potentially dangerous. So that is all very good. Can you tell me what you ate for breakfast this morning, if anything?
I had a protein bar.
Okay.
Not very nutritious today.
Is that what you typically have first thing in the morning?
No. I normally wait a few hours.
Okay.
I normally have like eggs, oatmeal,
Okay, so fairly
yeah.
nutritious on
Yeah.
Wednesdays. That's fine. All right. All right. Can you tell me something relevant going on in media today? Could be anything.
Football just started.
Very good. Football just started. You have a particular team that you root for?
Yes. I like the Dallas Cowboys.
Oh, wow. 49ers girl myself, but we're not judging.
That's the other half of my family, so I like both.
I also have a split Cowboys 49ers family. Good time.
Must be a thing.
Our neighbor is a Rams fan, so we're just having fun over
Yeah.
there. All right, very good. So let's go ahead and move on. I am going to begin with just a basic visual inspection here. So typically like to just kind of have a look, see if there's anything concerning going on externally. So obviously just in conversing with you, I don't notice anything particularly abnormal. There's no facial drooping or lagging. I'm not noticing any twitching of the eyes or anything like that, okay? So I'll just have you kind of look around the room. Don't focus too much on the light as it is rather bright, and I will be doing a lighted eye exam shortly. So just having a look over the basic musculature of the face, looking at the brow bone. Are there any signs of drooping there? Lashes appear very healthy and full. Just over here. Skin complexion is clear. Good. Hair is well groomed. Very good. Overall muscle tone is in line with someone who is physically active, so that is very good. Again, you just sit tall for me, shoulders back. Perfect. Okay, so posture is great. Clavicles midline. Okay, you can go ahead and relax your posture. And not noticing any wasting at the hips either. Good. Okay. Just gonna come around the back and have a look at your back. Again, no abnormality of the shoulder, scapular indentations even. Okay, very good. So let's go ahead and move on to our eye exam. I have a couple different things that I will test here. So you said you've not ever been to an optometrist?
No.
It's actually a good thing if you haven't felt like there was a need for you wearing glasses. I do sometimes recommend that you go just have a look maybe once every 5 years. If you don't need prescription lenses, that way they can just have a look in your eye, check for things like macular degeneration, any abnormality of the retina, that kind of thing. Okay, so I'm just gonna come in here. Okay. No abnormal discoloration, sclera is clear. No signs of conjunctivitis, and optic disc is visualized there. Very good. Okay. Check your hair here. Same thing, sclera is clear. No signs of abnormal mucosa, and optic disc is visualized here as well. Okay, very good. You have fairly light colored eyes. Do you ever feel like your eyes are sensitive to the sun?
Yeah.
So obviously, the lighter your eyes, the less UV protection, so I would recommend maybe wearing sunglasses, specifically while you're driving. Alright. So I'm just going to do a test to check for your pupillary reflexes. So ideally, when light shines into your eye, your pupils will constrict and dilate accordingly. So I'm just going to have a look here. This is fairly bright, so just bear with me for a second. good pupillary accommodation. Good, coming in close here. Do that one more time. I just have a little card here. Good. Okay. So lastly, for the light, I'm just going to have you follow it with just your eyes. Try to keep your head still. Okay. Good, and follow it in and out. Any blurriness or double vision there?
No.
Alright, so we are going to do a brief test of your visual acuity. So I have a mini Snellen chart here. I'm going to hold it a couple feet away from you here. Can you read this top letter for me?
E.
And here.
F. P. H.
Good. And here.
D. H. J. E. S.
Are you able to read that lowest line?
Yes. L. T. F. F. H.
Try that one more time.
L. T. F. P. H.
Very good. Okay. So I'm going to have you hold this occluder here and just place it on either side. So we'll start with perfect. Then I'll have you try the lowest line backwards.
H. P. F. T. L.
Good. And if we could switch eyes. And if you could read it forward for me.
L. T. F. P. H.
Good. Okay. So a little hiccup there, but I think we're okay. So I have you right about 20/20. Assuming you've never been tested for color deficiency, if you've not seen an optometrist. Okay. So these are Ishihara test plates, and essentially they're circles with numbers inside. The goal is to test to see if you have any issues with color deficiency or color blindness. So I'm just going to point to a circle here, and I'd like you to just indicate whether or not you see a number, and if so, what number you see.
29.
Good.
74.
Good.
7. 45. 16. I don't see a number.
Okay. You see anything here?
I see a shape.
So if you can trace that shape to the best of your ability. Perfect. And lastly,
35. 96.
very good. Luckily you are not colorblind, so that's very good. Surprising amount of people are partially colorblind and have no idea until they have this test.
Wow.
Alright, so all of that looks very good. I don't have any particular concerns about your eye health at this time. Just check off a couple of things here. Ophthalmoscope examination was normal. Clear and moist. Alright, Brittany, so let's continue to just move on here. Why don't we have a look at your nose and throat? So I just have a secondary tool here. This is called an otoscope. So this is going to allow me to have a look inside your ear. So no current ear pain or anything.
No.
Okay. So it just tickles a little bit as I insert it into your ear. I'm just going to pull back on the ear slightly here. Visualize the tympanic membrane, which is very clear, not noticing any obstruction. I do see some normal amounts of earwax. And it disappears if you have a trace of a piercing there. Is that to help with the migraines?
Mm-hmm.
Okay. Do you feel like it's pretty effective for you?
It is, yeah.
Your nose clear. Looks like there's slightly less earwax on this side. And tympanic membrane is visualized. Okay. Do you use Q-tips or anything to clean your ears?
Not very often.
Okay, so if you do, just make sure you're not inserting it too far into your ear. So right at the point where there's cotton, you don't want to really go any further than that. Okay? All right, so I'm going to clean this off and just have a look inside your nose and mouth. Any history of throat infections, swollen tonsils, tonsillitis, strep throat?
I had tonsillitis one time.
Okay, was that quite a while ago?
Yeah. Like probably 10 years ago.
Okay.
I was young.
As long as there's no chronic infection.
No.
Oftentimes we see if you have chronic strep or things like that, even tonsil stones, then you likely just need to have your tonsils removed. Okay. So I'm going to have you tilt your head back just slightly for me. These passages are clear. Right side is slightly pink, but otherwise normal. I can have you stick your tongue out for me. Good, and say and stick your tongue to the roof of your mouth. Perfect. Okay. You have very nice teeth.
Thank you.
All right. Jumping ahead just a little bit here, I'm going to do a bit of a cognitive test. So I have a couple things that I'm going to place in your hand. I'd like you to attempt to identify the object. Okay. Just close your eyes for me. And go ahead and feel around there.
Feels like not a paper clip, but like a clothespin, or what is that? I'm blanking on the name.
That's okay. Safety pin. Very
Safety
good.
pin, yeah.
We'll count that as a yes. Very good. And here.
Just some type of little, is it like a carabiner?
Carabiner. Very good. And if you can tell me if this object is any different than the last.
I think it's the same, just bigger.
Very good. Perfect. And then I am going to, you can open your eyes. I'm going to hold this out for you as a little table here. I have 3 very basic puzzle pieces. I'd like you to attempt to put them together for me. Sorry. You're okay. Take your time. Very good. Okay. Did a good job with that. That just tests your cognitive health, your ability to sense everyday objects, Stereognosis. So all of that is good. Okay, so I'm going to hand you this pen, and if you can just, somewhere in this little space here, doodle a triangle for me, and a circle, and a square. Very good. Okay, so just testing your dexterity, ability to hold an everyday object right with the pen. All of that is good. All right. So let's go ahead and move on. I think at this time I will proceed with the stethoscope examination. So I'm going to do a bit of listening auscultation to your heart and lungs. So I'll start with your heart. Any history of cardiac health, heart palpitations, tachycardia, bradycardia? Have you ever seen a cardiologist for anything?
No.
Okay. All right. So at this time, just take regular normal breaths.
Okay.
Gonna listen here at your artery. Very good. I'm gonna come around the back. Good. Take a deep breath in for me. Good. Release. One more. And release. I'm going to tap on your back. Every time I tap, I'd like you to say 99.
99. 99. 99. 99. 99. 99.
Good. Okay. All right, so nothing notable with your heart and lungs, both clear. Heart rate was within normal limits. Okay. All right, so let's go ahead and continue on here. So I'm going to just cleanse my hands and put on a pair of gloves before we proceed. Any questions for me so far?
No.
So before I start with some palpation, I'm just going to check your ocular reflex. So this is just a regular elongated Q-tip essentially. I'm going to bring it to the corner of your eye and I'm going to intentionally try to elicit a blinking response.
Okay.
Don't force it, but if you feel the need to blink, just allow. appears to be intact. So what I'm going to do at this time is just a few palpations. So essentially just feeling around with my hands, using my fingers to kind of feel for any nodules or anything like that. I'm going to start with your scalp, so I'll come back around the back. Do you ever find that you have issues with your hair? Your hair does appear very full. Any issues with hair loss or anything concerning excess breakage?
No, I did in the past, but not now.
Okay, was there any specific reason?
I was on Accutane.
Oh, okay, so very common that Accutane can cause early onset hair loss. But you feel like it's grown back, or it's
Yes.
just okay? Good. How long has it been since you've been off Accutane?
I got off in 2019.
Okay, so quite a while. All right. So just feeling around the scalp for anything particularly abnormal. Sometimes there are nodules or maybe lumps or bumps that you might be missing in the shower. So far not anything. Okay. So while I'm back here, I'm also just going to feel for the spine, the back of the neck here. Okay. And up the shoulder. Scapular indentation is parallel here. If I could have you hold your breath for me, so breathe in and hold. Good, and release. I'm going to have you hinge forward at the waist here for me. I'm just going to feel for any signs of abnormal curvature of the spine. Okay, good. And so that looks very good. And I'm going to have you twist. Any pain or discomfort there?
No.
Good. And the other way? Any pain or discomfort there? No. Good. Now, rather than twist, if I could have you lean here and opposite. Does that all feel okay?
Yes.
Just checking a little bit of your mobility. All right, so we're gonna continue with our palpations around the face here. So just gonna feel at the forehead, feeling for your nasal passageway, any signs of obstructed sinuses, any tenderness at the brow.
No.
I'm not noting any edema at the temporal region. And along your jaw, do you ever have any issues with your bite or with TMJ symptoms?
No.
Do you grind your teeth?
No.
If I could have you slide your jaw side to side for me. Good, and open, close, and open, close. Good. No tenderness of the ear, behind the ear?
No.
Okay, so I'm just going to feel briefly along the lymph nodes here, looking for any signs of swelling, infection. Good. If I could have you swallow for me. Good. Clavicular nodes also are not. Good. Okay. Just have a feel for your arms. Closer to the touch up here than lower down, which is normal. So we tend to see either warmer or colder hands. In your case, warmer. And no issues at the joint. Good. Well-groomed fingernails. Okay, I'm just gonna look at the palm, looking for any signs of abnormal discoloration or erythema, not notable. All right, very good. So look at this side as well. Okay, so then look at the knuckles, skin texture. Okay, well, that looks okay. All right. Very good. Okay. Scalp health appears normal. Not noting anything concerning there. Upper extremity mobility is intact. Just following up on those movements, I'm going to have you perform a couple movements of your upper extremities, of your arms. You could raise your arms above your head for me. Any pain or discomfort there?
No.
And cross your chest here. Good. And the opposite way. Good. And then if you could reach your hands behind your back. Any difficulty there?
No.
Alright. All of that looks very good. Let's see. I'm going to go ahead and test some reflexes here. So I will start at your face and kind of work my way down. So this is just a small reflex hammer, kind of like the test we did with the Q-tip. I'm going to tap around your eyes and just see if we can elicit that blink response, okay? I'm going to test at the elbow, so I want you to just kind of rest the weight of your arm in my hand here. Good. Just rest your arm here. Good. Very good. Okay, go ahead and relax this arm. Repeat the same thing on this side, so I'll have you bend slightly and then just rest the weight of your arm. Good. And then just relax. Perfect, okay. Alright, Brittany, so we're going to go ahead and test the lower extremity reflexes just briefly. So I'm going to test here at the knee. Good. Good. Very good. Okay, so no discrepancies with your reflex reaction. Okay. And continue. So I'm going to test a couple of different things. The first one being your hearing. So you said you don't typically have any issues with your hearing. Mm-hmm. Do you frequent any loud events? Concerts?
No, but I listen to music.
Loud music, okay. Is it like over the ear noise canceling? Okay. If you have an iPhone, it will alert you if your music is too loud. Would kind of pay attention to that because the levels are pretty accurate. So if it gets you in the red zone, you might want to tone it down a little bit. I know typically if you're listening to it while you're working out, you kind of need a little bit louder. Consider taking breaks, maybe like a 5-minute interval. If you're in between sets and you're just resting, you can take it off for a couple minutes. Let's test your hearing with a couple of different things. I will start by just making a sound with my hands. So I'm going to ask you to close your eyes and just indicate whether or not you hear it. You can either say yes or just nod your head. Okay. So now I'm going to test on either side. slightly different sound here. So can you tell me if you can hear this? Just make sure. No. Constructing a test here. So I'm going to test directional hearing. Just indicate on what side you hear it.
Left. Right. Left. Right. Right. Middle.
Very good. Another tool here. This is actually a thermometer, but I'm going to use it to test your hearing. So I'm going to bring it from one side to the other. I want you to tell me what side it starts on and what side it ends on.
Okay. Right. Ends on left. Left to right.
Good.
Left to left.
Good.
Right to left.
Very good. And
Left to right.
perfect. Okay. Do you feel like any of that was particularly difficult for you to make out?
No.
Mhm. So we're going to move on to a bit of a sensory examination. Now, this is part of your neurological assessment to make sure that there's nothing going wrong with your physical components, that you're able to sense sharp, dull, soft, cold, that kind of thing. So I'm going to start with something pretty basic here. This is just that same Q-tip. So you're going to feel a light, kind of wispy sensation. Just indicate if you can feel it.
Okay.
Okay. So I'm going to repeat the test. This time I want you to indicate where you feel it. So for example, forehead, nose.
Forehead. Temple. Cheek. Cheek. Neck. Collarbone. Arm. Forearm. Thumb. Ankle. Other ankle.
Good. And I've got a cold object here. I want you to tell me if it feels the same on both sides as far as temperature. So
Yes. 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 Yes.
okay. You feel vibration here?
Yes.
Good. Feel it there? Vibration at the jawline.
Yes.
Here.
Yes.
Here.
Yes.
Good. And at the collarbone.
Yes.
Tell me when it stops.
Stops.
Good. Here. Tell me when it stops.
Stop.
Good. Here. Tell me when it stops.
Stops.
Very good. Okay. So lastly, I'm going to test sharp sensation. Now, it's fairly sharp. It's not going to hurt, but you'll definitely feel that it's pretty distinct. So just close your eyes for me. I want you to indicate just firstly if you feel anything. So do you feel this here?
Yes.
And here?
Yes. 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 Yes.
As they come down the upper extremity, does it feel any less sharp anywhere or any more sharp?
No.
Okay. And here?
No.
Good. I could have you expose your palms for me. Any difference in sensation here versus here?
No.
And here versus here.
No.
Okay. All right, great. You can go ahead and open your eyes. That's very good. Alright, so we just went over quite a few things. Your sensory function is definitely intact. I didn't notice any discrepancy there. And there were no areas where something felt number or like less noticeable.
No.
Good. Okay. Alright, so let's go ahead and proceed. We are almost done with your examination. I am going to do just a very brief check of your abdominal cavity. I want to feel around, see if there's anything palpable, abnormal, any nodules or anything that I'm feeling in the abdomen. And then that should close us out. So give me just 1 second here. Alright, we're going to go ahead and do a brief abdominal assessment here. So I'm just going to start by having a look at the overall midsection, looking for any signs of abnormal distension. Is it okay if I adjust your clothes just a little bit here? Okay. Just going to pull your top up above the rib cage and hands just below the umbilicus. Just having a look at the overall abdominal structure. So many prominences are below, so I do some palpating here with my hands, just deeper flat-handed motion, feeling just below the rib cage. Along the pelvic bone, just below the umbilicus. And directly across the midsection. Maybe take a breath in for me, Brittany. Deep breath in. Good, and release. Okay. Skin texture is clear, skin integrity is intact. Okay. It's a bit of a deeper palpation here, feeling around for your organs. Also getting a feel for the intestine, any noticeable bloating or palpable blockages. Just kind of feel for the kidneys. No signs of umbilical hernia, I'm not having any bulging or anything here at the belly button. Okay. I'm going to do some percussing along the abdomen with my reflex hammer. You're going to feel a tapping. Okay. Lastly, for the abdominal exam, I'm going to test your abdominal reflexes. Now, this is slightly different than the sensory exam. You don't have to respond whether or not you can feel anything. more so looking for the natural reactivity of the reflexes of the abdomen, okay? So I'm going to start with a softer object here. Just looking for the natural flexing of the muscles upon stimulation. Okay. Let's test that again with cord sensation. Very good, strong reactivity there. Okay, all right. So nothing notable with your abdominal cavity. I don't see any signs of distension or bloating. It doesn't appear as if you're having any issues with indigestion, no notable blockages. I do hear some digestive sounds. So obviously your protein bar is being turned into nutrition, which is good. So all of that looks okay. I'm going to have you sit back up on the table for me and we will go ahead and discuss the findings here, okay?
Okay.
Okay. All right, Brittany. We just finished up your abdominal examination. How are you feeling?
Good.
Okay. Did you have any questions about any parts of your exam in particular? Anything that you thought was concerning? Anything you wanted to follow up on?
No.
Okay. So as far as I'm concerned, everything was perfectly fine. There was nothing that I noted with your cognitive health. You appear to be thinking clearly and effectively. Deductive skills are intact. Visual acuity is intact. Hearing, nasal passages are clear. No issues with your nose or throat. I did see just a little bit of discoloration on the left nair. So just some slight pinkening. I'm not sure if you've had any flare-ups or anything there, but it was just slightly pink. Nothing that I would say is indicative of anything emergent, so just something to note. You also had slightly more earwax in volume, and the texture was just slightly more liquid, more viscous on the left side as well. So could be something to do with your sinuses. Maybe you just have a mild case of seasonal allergies that you're not aware of, but nothing that I would say is notable if you're not noticing any symptoms.
Okay.
Right. Cardiac health was intact. And lung health was normal. No issues with distension or anything of the abdomen, and all of your reflexes were good. So aside from the migraines, which I would suggest you keep track of, even if you just like write it down, that way you know if they're coming at a certain time of the month, or if they seem to be more frequent, less frequent, if they brought on by anything other than just caffeine. Definitely something notable, and then would potentially refer you out to a neurologist.
Okay.
Okay. All right, so I will go ahead and have the medical assistant come in and she will get that vaccination done for you.
Okay.
Okay. All right, Brittany. Thank you so much. It was very nice to meet you. Would love to see you back in about another year.
Okay. Thank you so much.
Get home safely.